Well, a warm welcome to today's talk, Friday the 16th of June now. We've been looking in previous videos about, firstly, the fact that there are excess deaths, and secondly, that a lot of these excess deaths are cardiac related. Now, I want to look at some data from Australia that confirms this, just released in the past few days. Now, this is from the Australian Society of Actuaries, of course, dealing with life insurance. And this is their report here. A COVID-19 mortality working group, and they're looking at 2022, where there was over 20,000 excess deaths in Australia, 22,000. Now, this is 12% excess deaths, so the excess deaths in Australia for 2022 were 12% higher than would be expected. Now, this is partly because it's a pandemic year in Australia, because they had their pandemic a bit late, you might remember, because of their lockdowns, because it's an island, they were able to contain the situation for longer. But apart from that, the excess deaths are still higher than would be expected, and we'll be looking at the cause of it in a minute. So they'd say excess mortality is widely regarded as the best measure of the overall impact of the pandemic, which is true, since it includes deaths both directly and indirectly. And of course, what we're interested in is to what degree is COVID causing excess cardiac deaths, or is it other factors that are causing excess cardiac deaths? This is what we need to tease apart, which we need a proper investigation of. Now, of the 20,200 excess deaths in 2022, they're saying 51% were from COVID-19, but of course we know a lot of these people had significant comorbidities and were mostly elderly. But they're saying another 15% were COVID related. So what they're actually saying here is 51% of these excess deaths were from COVID, which we could argue about. This is what they're saying. And 2,900, 15% were with COVID rather than from COVID. Now, that still leaves 7,000 deaths, 34% of the total excess deaths, that had no mention of COVID-19 on the death certificate. And this is 4% of the excess deaths, which, remember, were 9% in total. So consistent with other countries. In fact, these numbers are a little lower than we're seeing in quite a few other countries. But remember, it is skewed somewhat because of Australia's relatively late pandemic compared to other countries such as the United States or the United Kingdom. But it's still there, and the actuaries are saying this is extraordinarily high in itself. So even 4% excess deaths would be extraordinarily high and statistically very significant. Most deaths were in 65 age group plus. But in all age groups, there was at least 5% higher mortality than would be expected. So in all age groups, including the younger age groups, mortality was 5% higher than would be expected. Now, of course, the numbers are smaller, thankfully, in the younger age groups, but there was excess mortality in all age groups. Now, they don't break down the age groups specifically, unfortunately. That would be very interesting if they did that, but they're saying it was higher in all age categories, indicating that there's other factors than the pandemic going on here, because we know that COVID very rarely, thankfully, kills young people, but 5% higher in all age groups. Now, it's noticeable that there were excess deaths in all age groups, and that the excess is generally significant. This is not a statistical artifact. This is statistically significant, even after removing COVID-19 deaths. So excess deaths are higher in females than males in Australia. And they say the differences are worth investigating. Now, this is the Society of Actuaries saying the differences are worth investigating. It would be nice if governments had the same way of thinking, that these were to be investigated in their own terms, as we've been calling for a long, long time, but still awaiting, unfortunately. Now, they do say that the small numbers, but there again, Australia is a relatively small population. There is considerable natural variation, which is true, but it remains true that these are statistically significant. Whereas in all states, Western Australia, excess deaths were delayed due to late reporting and late reopening, really, because they tried to close the border down for longer. So the pandemic was even later in Western Australia than other parts of Australia. Now, many more deaths from ischemic heart disease affecting the coronary arteries. And we looked at heart disease recently, looking at heart failure. Much higher number of deaths than expected from ischemic heart disease, despite continued deaths from dementia, continued increase in deaths from dementia. So what we're actually seeing here is more people dying of disease of the coronary arteries. So the blood flow was not getting through the heart. Something was causing blockages, atheroma, inflammation in these coronary arteries, blocking them off. And of course, coronary arterial disease is a factor in heart failure that we looked at. But when we looked at the UK data recently, actually it was not the UK data, it was the English data, we saw a lot more deaths from heart failure, but we also saw more deaths from ischemic heart disease, statistically more than we would expect in previous years. So Australia is being completely consistent with that. Here's their graphic here that shows quite a significant increase. It's always quite potent, really, when you see the increase. Now, in graphical terms, now they're saying that the yellow is from COVID, but of course we could argue with that, but that's what they're saying, so we have to accept that data. And that's the blow up of the graphic there. So we see that there are these 4% of the 9% of, so that means 5% were COVID related, 4% were not COVID related deaths. So we're still seeing that. Deaths from respiratory disease have been significantly lower than expected. Now, this is consistent with what we were seeing in the United Kingdom as well, that we would expect more deaths from respiratory disease because COVID is primarily a respiratory infection, but they're not seeing those. In the UK, they were lower than we would expect, and in Australia, the actuaries are saying deaths from respiratory disease have been significantly lower than expected throughout the pandemic. So there we see confirmatory data from Australia, not from government sources, but from the Society of Actuaries, confirming the increase in heart disease deaths and the overall numbers of deaths. Now, the Society of Actuaries in Australia are saying that this is not related to pharmaceutical interventions. They are saying that, but they're also saying they don't know what the causes are. So I think we can conclude that they don't really know what these causes are. They say they should be investigated. We say they should be investigated. And yet we hear this deafening silence still from many around the world, and from governments in the United States, Canada, Australia, New Zealand, the United Kingdom, Europe. Unfortunately, still hearing very little. So good to get that confirmation, I think, really from a completely different source. And sad that people are dying in excess and from similar conditions all around the world, all essentially at the same time. Almost as if there's some common factors going on here, some common etiological factors. So let's hope we see some investigation soon. We have got the COVID inquiry going on in the UK at the moment. It seems to be an incredibly long-winded, bureaucratic, legalistic affair, but we'll give it a chance. In a couple of years, it might come up with something. We'll see. I'm not holding my breath based on other inquiries conducted by the British government, unfortunately. But we'll leave that brief video there for now, and thank you for watching.